Today, I want to talk to you about whether you should use ice or heat for back pain, neck pain, shoulder pain, knee pain, or any type of joint pain that you might be having. Hey, I'm Dr. Matt Simons from Palm Beach Health Center. Speaking in general terms, ice is usually best for acute conditions, meaning the injury happened within the last 72 hours or last 3 days. Those types of injuries are typically going to have a lot of inflammation, which is your body's way of trying to protect itself and start the healing process. Typically, though, our bodies produce too much inflammation because we have bad diets. So this can be painful and actually slow down the healing process if we're not careful. So ice is usually best to help numb that area, to cool it off and get the inflammation to calm down. Heat, generally speaking, is best for more chronic conditions like chronic muscle spasms or really tight muscles. We typically use heat after a patient has been in the office for some time and if it's been at least 3 days since the injury. Heat is good to relax the muscles and just make the patient feel better overall. Now there's a danger in using the wrong one at the wrong time. For example, we've had patients that put heat on their injury too soon after an acute injury. This is going to actually increase inflammation in the area and can cause more pain and suffering. Putting ice on a chronic painful condition is probably not going to have the bad side effects of putting heat on an acute injury, but it may not have the benefit you would get from putting heat on that same injury. So it's important to use the right one at the right time. If you found this useful, please leave a comment and feel free to ask a question. I'd love to hear from you, and we'll talk to you soon. Thanks.